Hi, this is Jessica DeMassa with WTF Health. I am here at the G4A Accelerator launch in New York City. And right now joining me, I have Zsuzsanna Varga. She is the global head for startup partnerships with G4A for Bayer. So tell me exactly what it is that you do. What is the global head for startup partnerships? What's a startup partnership mean to G4A?
Yeah, so our job is really to bridge the two very different worlds, right? So on one hand, the startup world, very fast-moving innovators, ecosystem, and on the other hand, really established players, in our case Bayer, as a healthcare company, to really merge and bridge and create very powerful new partnerships together. To really, at the end of the day, we want to create new solutions that are helping patients and consumers being, really the CEO of their health. And we're really excited to kick off our program tonight in the US, where, we're trying to establish a new footprint and really leverage the very rich ecosystem we have here in the US. And super excited to, be here tonight and have you with us.
Good, well, thank you. So tell me a little bit, for those who don't know, how the G4A program is structured, because it's unique. It's got the deal maker, the accelerator, and the generator. So what's the difference of those? How do they work together?
Sure. So we really want to cover the entire, if you will, value chain of startups. So really going from early stage to young companies and startups that are already on the market with the solutions. So hence we have the generator and deal maker that really, partnerships with companies that are already on the market, that have a product that's already working, to really have commercial deals right away, to really push and fast-track collaborations. Then we also have the accelerator, which is sort of more experimental and targeting early-stage startups that already have a working prototype but haven't hit the market yet, that really can leverage the buyer ecosystem and value chain to validate and bring to market their solutions. So so that's what we do. We cover sort of early and mature startups, and then also health and care, so meaning from sort of corporate language again, pharma and consumer health business units. So that's what we do, and that way try to be very powerful.
No, definitely, and I think what's different about the way your accelerator is organized is it kind of gives a little bit of wayfinding to the startup. So it's like, I know I go this way, or I know I go that way, which is often one of the complaints you hear from startups trying to work with a big company is, I don't know where to go.
It's complex. I mean, healthcare is complex, but also sort of the whole, I think, like stakeholder landscape is also complex. So we try to make it simple, but at the same way really cover our whole base, and that way really increase the impact that we can make in healthcare.
So talk to me a little bit too about the ecosystem development that you're doing. I understand that helping develop different innovation ecosystems is a priority for you guys. So what are you doing? Where are you at? Tell me.
So what we're trying to do is really cover the very rich, very established markets already in innovation. So we're in the US now with our programs, but then also with our Meetup STEM for Health community. But really what we're also very interested in is kind of grasping and getting a hold on very early emerging markets, if you will, in innovation. So Eastern Europe, South Europe as well. So speaking of, Hungary, for example, Ukraine. So really, because we had very good examples where from these countries, we had very cool tech coming up that we sort of had on our radar first, and that we could help, on the other hand, really grow. So we're big fans of these really emerging innovation markets. But at the same time, also like US, obviously there's so much happening, and we just could not afford, to not be here and collaborate and find these awesome players.
Okay, so what has you most excited about the future? I guess looking forward at the different companies that you're encountering, the challenges you're standing up, the ecosystems you're developing. What has you most excited?
Yeah, so for me personally, really to really find that one big player where we could make a huge impact. That I was talking about unicorns. I like to talk about tech corns. Sort of like find that really completely new thing that nobody thought of, that everyone was like, well, this was an underground, this is never going to work thing, but together, we made the impossible possible. So very abstract, but I think we're going to get there somehow, and I'm really excited about
We're going to help. So if you are that decacorn that Zsuzsanna is looking for, what you need to know to get a hold of her is to go and find out more about G4A, and they can do that at the website, right? Which is?
Right, G4A.health, so very simple. Actually, we have our applications open right now for the accelerator and the deal maker program. So if you think you could be the big next tech corn, check it out, see what kind of topics we're working on, and look us up.
Awesome. Thank you so much for joining us.
Thank
It's a pleasure
you.
to be here and watch
Thanks,
this whole thing unfold. I'm Jess Tomasa with WTF Health. Thanks so much for joining us.